Okay, so have you ever wondered if our bodies come with a built-in hidden warning system before a major medical emergency hits? Well, today we're decoding the silent alarms our brains actually trigger before a stroke. We're going to break down exactly what happens in those critical hours and days leading up to an attack and, decode those subtle signals that most people tragically just brush off. So get ready, because the stuff we're exploring in this explainer, it completely changes how we look at neurological emergencies.
40 seconds. Yeah, literally by the time I finish this sentence, another brain on this planet has been hit by a stroke. Every single year, we're talking almost 6 million people worldwide losing their lives to this. It's actually the second leading cause of death globally and the absolute #1 reason for permanent disability. The scale of this is it's immense. And that urgency, it is ticking away right now. So let's dive into this idea from Dr. Favor Edme. Because honestly, this right here is the core secret of what we're talking about today. We tend to think of strokes as these sudden, out-of-the-blue lightning strikes, right? Like you're totally fine one minute and waking up in an ER the next. But the medical reality, it tells a completely different story. In a huge number of cases, a stroke is actually a predictable endpoint. Your brain is actively giving you very specific warnings hours or even days before the main event actually arrives. To really understand these warnings, we have to look at what doctors call a TIA, or a transient ischemic attack. Now picture this. A tiny clot suddenly forms, or travels into a narrow brain artery, and it temporarily blocks the flow of life-giving oxygen. The brain tissue downstream immediately starts to starve, which triggers instant stroke symptoms. But then, as quickly as it started, the clot just dissolves. Blood rushes back, the brain recovers, and the symptoms vanish. Now, you might think you're in the clear, but this temporary blockage is actually the ultimate warning shot. Let's see how this builds into a very real, literal ticking clock. A massive study published in the journal Neurology looked at over 2,400 stroke patients and mapped out this exact timeline. Get this, the warning signs of an ischemic stroke can show up as early as 7 days before the main attack. In fact, 43% of these TIAs happen at some point during that preceding week, and 9% happen the absolute exact day before. We are looking at an incredibly tight, compressed window where the brain is basically screaming for us to do something. So what do these warnings actually look like in real life? Well, warning number 1 is sudden weakness or numbness on just one side of the body. This is definitely the most documented pre-stroke alarm out there. We're talking about a face suddenly drooping on one side, or an arm that suddenly feels like it weighs 100 pounds and just refuses to rise, or maybe a leg that randomly starts to drag. The absolutely crucial word to focus on here is sudden. And what's really fascinating and kind of terrifying is how this completely subverts our natural human instincts. When we feel a weird pain or a heavy limb, our instinct is to just brush it off, right? We blame the gradual achiness of arthritis or maybe just the familiar tiredness of a super long day at work. But a TIA does not build up slowly. It hits in seconds, without any prior warning whatsoever, and strictly on one side of the body. That sudden one-sided pattern, that is your brain's literal geographical map showing exactly where the blood flow just got cut off. Warning number 2 is aphasia. Imagine the terrifying experience of suddenly knowing exactly what you want to say, but the pathway to actually say it has just completely vanished. Your left side language centers have momentarily gone dark. You might speak in garbled, totally confused sentences, or, and this is equally scary, you might completely lose the ability to understand what someone else is saying right to your face, even though you are wide awake and perfectly alert. Sudden speech difficulty like this is one of the most rock-solid, reliable pre-stroke warnings in all of clinical medicine. Moving on to warning 3, we have a condition called amaurosis fugax. This is a sudden vision change, but patients often vividly describe it as a physical curtain literally being drawn across part of their sight, or even a brief total loss of vision in just one eye. This happens because the ophthalmic artery, which feeds the eye, actually relies on the carotid artery's blood supply. So when that vision suddenly drops out, it is a glaring red flashing light signaling a dangerous interruption in that exact same carotid pathway that's involved in many major strokes. Now, a quick aside, not all strokes are caused by clots, right? Some are hemorrhagic, meaning a blood vessel actually bursts inside the brain. And that brings us perfectly to warning 4, the thunderclap headache. I mean, the name pretty much says it all. This is not a slowly building tension headache from, skipping your morning coffee or feeling stressed. This is an explosive event that reaches absolute maximum severity within seconds. Patients universally describe it as the single worst headache of their entire life. If a headache hits you like a sudden thunderclap, that is an absolute, non-negotiable medical emergency. Warning 5 is a sudden loss of balance or coordination. Deep at the back and base of your brain, you've got the cerebellum and the brainstem, and they basically act as your body's gyroscope. If blood flow to these structures gets blocked, you might suddenly stumble, veer weirdly to one side, or just feel like the floor beneath you is aggressively tilting. And again, it's that sudden onset without any clear trigger, like it's not just standing up too fast, that makes this a major neurological warning.
Okay, please listen closely to this part because this is the most crucial point of all. If any of these terrifying symptoms suddenly appear and then completely vanish a few minutes later, human nature naturally floods us with this massive sense of relief. We think, oh, phew, I'm fine, it was nothing. But getting better on its own is exactly what a TIA does. That disappearance, that is actually the most dangerous moment in stroke medicine because that relief breeds complacency. It is not reassurance, it is a literal countdown.
To completely shatter any remaining complacency you might have, consider this number, 17.8%. If you experience a TIA, your risk of having a full-blown stroke in the following 90 days can be as high as 17.8%. The exact same arterial conditions that cause that temporary clot, they are still sitting right there, perfectly primed to produce a permanent, devastating blockage. And this brilliantly illustrates the true terror of that ticking clock we've been talking about. Of all the strokes that follow a warning TIA, almost 50% of them strike within a 48-hour window. Half of them occur within just 2 days of that initial temporary episode. That means if you decide to just, sleep it off and maybe call your doctor next week, you are literally playing Russian roulette during the absolute highest risk period possible. Because of that brutal 48-hour window, the only correct actionable response to a resolved symptom is a same-day emergency evaluation, not a scheduled GP appointment for next Tuesday, a true medical emergency. Within the first 24 hours, doctors need to do brain imaging, draw blood tests, run an ECG, and complete a full vascular assessment. You have to find that underlying cause while the window of opportunity is still actually open. The whole reason we rush for that 24-hour evaluation is so we can deploy these absolutely crucial 48-hour interventions. Doctors have an incredible arsenal of preventative tools today: antiplatelet medications to stop the clotting, aggressive blood pressure management, and even surgical procedures to actually clear out the carotid artery. But here's the catch. These treatments are only operating at their maximum preventative benefit when they're started immediately. Every single hour you delay drastically reduces their effectiveness. Now, taking a quick step back from the acute emergency side of things, what actually causes the pressure that leads to these TIAs in the first place? Well, it's high blood pressure. It is the single most important modifiable risk factor for both TIAs and full-blown strokes, and the source material heavily emphasizes that real lasting progress doesn't come from extreme crash diets or crazy measures. It comes from the simple, consistent, daily management of your blood pressure through healthy routines and gentle exercises. Controlling that underlying arterial pressure is absolutely your frontline defense. As we wrap up this explainer, I want to leave you with the absolute most actionable, memorable tool in neurology, the FAST acronym. F is for face drooping on one side. A is for arm weakness or drifting downward. S is for speech difficulty, slurring or garbled words. And T stands for time. Time to call emergency services immediately. Memorize this sequence. Teach it to your family. It is literally your diagnostic checklist for a brain under threat. So, we've seen the timeline, we've decoded the hidden symptoms, and we've exposed the massive danger of ignoring that false sense of relief. Time is brain. So I'm going to leave you with this final, provocative thought. If your brain gave you a cinematic, sudden warning today, if your arm went incredibly heavy, or your vision dropped like a curtain for just 5 minutes before completely returning to normal, would you actually listen? Or would you just go back to sleep? Stay vigilant, listen to your body, and I'll catch you in the next explainer.